So ano ba ang dahilan bakit ba maraming namamatay ng cervical cancer? Let's not forget, hindi naman talaga dapat silang mamatay, no? Have they had a cervical cancer screening? Una, lack of comprehensive cervical cancer screening network. Ang cervical cancer screening natin dito sa ating bansa is characterized as opportunistic. Ang ibig sabihin nito, the screening is initiated by a person or a doctor. Ideally, dapat we should have a population-based cervical cancer screening na kung saan ang mga babae ay iniimbitahan para magkaroon ng screening. Meron man silang nararamdaman o wala, na iimbitahan sila sa mga ganitong klase ng screening. Based on the WHO 2001 health survey, doon makikita na only 7.7% ng ating mga kababaihan had undergone cervical cancer screening. Whereas, ang requirement ni WHO is dapat maka 70% tayo ng total population. So ang layo pa natin, para ma-accomplish natin yung goal na 70%. Number 2 is the lack of awareness. There is a generally lack of awareness among our women population, Unlike breast, Common nakikita ito, madali itong maintindihan kapag sinabi mong breast cancer. Pero pag sinabi mong cervical cancer, nasaan ba ang lokasyon ng cervix? Como ito'y nakatago, mas maraming hindi nakakaintindi at walang masyadong may alam kung nasaan ang cervix.
Meron po ba kayong idea kung ano ang cervical cancer?
Wala po eh.
Cervical cancer, ha? Sa palagay niyo po, ano po ang cervical cancer? Meron po ba kayong idea kung ano yung cervical cancer?
Sakit na nakakamatay.
Sakit na nakakamatay. Meron po ba kayong idea kung ano yung cervical cancer?
Wala po eh.
Wala. Pwede po bang malaman kung ano pong idea niyo sa cervical cancer?
Ano ba? Women's problem
Okay.
nowadays.
Ano sa palagay mo ang cervical cancer?
Cervical cancer. Ang purpose.
Alam mo ba kung ano yung cervical cancer?
Sa daddy po, buko.
Okay.
Alam mo ba kung ano ang cervical cancer?
Cervical cancer. Yung sa lang mga babae, gano'n?
Sa ari ng babae.
Pangatlo, frequently no associated symptoms. The cause of cervical cancer is HPV infection. Ang HPV-causing cancer does not provide symptoms. Dahil ba sa walang simptomas ito, ang mga lalaki or men can pass it to other women through sexual intercourse, silently. So now, the transmission is silent. Once the HPV is transmitted to you, may potential ito na maging cervical cancer. Although hindi naman namin sinasabi na lahat ng HPV infection will proceed to cervical cancer. Yung ibang HPV infection will persist and proceed to cervical cancer. Again, itong HPV persistence na ito, 0 ang simptomas. So that will not warrant you to seek consult to a doctor. As time goes by, mag-change ito into a pre-cancer lesion, or yung bang papunta na sa cancer. At this stage, again, 0 ang simptomas. A few more months to years later, yung pre-cancer mo will go into stage 1 cervical cancer. Dito, 0 to about a few symptoms ang mararanasan. But most often than not, it will not still warrant you to come and seek consult to a doctor. Later, as months pass to years, no, magiging stage 2 ka na and stage 3. Then, the vaginal bleeding starts. Dito, papatingin ka na. Unfortunately, at this stage, no, your chance of survival, no, drops. From 100%, it can drop to about 60% when you reach stage 2 or down to 30% when you reach to stage 3. Ang ibig sabihin nito, ito yung porsyento na buhay ka in the next 5 years. Nag-effort ka na, gumastos ka pa, di ka pa sure kung buhay ka within the next 5 years. So anong dapat gawin? And lastly, the lack of screening facilities and expertise and of treatment facilities in the rural areas. In a study by Sorrento et al., which compared urban versus rural community screening program, urban being represented by the National Capital Region, whereas rural, represented by Bicol, showed the disparity between these two areas. Lahat po ng nasa rural when compared to Manila, kulang. Mula sa cervical cancer screening coverage hanggang sa number of screening facilities per population ratio, hanggang sa number of clinic to population ratio, and the number of personnel to population ratio. Lahat kulang pagdating sa probinsya. Kulang sa supply, kulang sa dami ng fasilidad. Let's look now naman sa number of expert, the doctors, to take care and screen our women population. Kakayanin kung sila lang ba? Imagine lang natin ang total screening population natin is about 25 million, no? These are age 25 to 65 years old, and assuming there are only 6,000 OB. Did you know it will take each OB to screen 4,155 patients in a year, or 12 patients per day for 365 days, meaning walang Pasko, walang New Year, walang mahal na araw, para ma-screen nila lahat yung 25 million women. Take also into consideration geography, no? As most doctors are practicing in the city and not in the rural areas. I guess, isa na ako doon sa makasalanan, no? Na nagpa-practice dito sa syudad at hindi sa probinsya. And by God, thank you for the midwives. Kasi kung hindi sila, sino na? So behind all this, 11 of our kababaihan are namamatay araw-araw sa sakit na entirely preventable. I'm sure most of these women na nagkaroon ng cervical cancer ngunit namatay, gumastos ng katakot-takot na perang pagpapagamot sa pagbabakasakaling makure sila ng cancer nila. Pero sa isang banda, imagine nyo na lang if yung perang iginastos nila, no, na ipinag-screen nila or ipinag-screen ng taong bayan. Hindi ba mas economical yon at walang loss of life?